female hormones or go through menopause and require female hormones are those women who have symptoms that they want to treat. We don't unilaterally put everybody on female hormones. Each particular process that these gentlemen treat, including particularly heart disease and problems with bone densitometry and weakening bones and all those issues that are somewhat helped by female hormones, as Dr. Ben Simon stated, women catch up as far as heart disease goes after they stop having the hormones. Well, we have different ways of treating those processes now, so we don't unilaterally put everyone on hormones. The issue of putting people on certain types of hormones, whether one type or another, is also somewhat controversial. To circle back to your issue, when we put women on postmenopausal hormone replacement, if they have a uterus, they need to be on two hormones. They need to be on progesterone and estrogen. Progesterone is because if you still have a uterus and you take estrogen alone, you're increasing dramatically your risk of uterine cancer. So you need to be on two hormones. If you don't have a uterus, there's no need to take the progesterone. So that leaves us with estrogen. The estrogen, for the most part, is the main component that helps women avoid a lot of the symptoms that you will have, such as hot flashes, vaginal dryness, hair changes, skin changes, mood swings, insomnia, problems with vaginal lubrication, libido. It goes on and on and on. Feeling out of control is one of the #1 symptoms I get from patients. Depression. They just don't have the same way they approach each problem. They're much more irritable, and so for lots of reasons, and I still believe this, that women belong on a hormone replacement program if they're having those kinds of symptoms. If they're fine through the menopause and they go through it and they don't have any struggle with it, then I don't necessarily prescribe it. So, the difference between hormone replacement both orally or taken on the skin is very dramatic. It's very dramatic. We used to only put people on female hormones orally, and then they discovered that you could give female hormones transdermally. And so women are given transdermals much more often than they're given oral medication now, for one simple reason. When you give estrogen transdermally, you do not raise your sex hormone binding globulin. Sex hormone binding globulin is something that binds to your hormones and inactivates them. And since women make testosterone as well in their ovaries, that same hormone binding globulin attaches to testosterone and it will decrease your libido, which is very dependent upon your testosterone levels. So giving transdermal hormones doesn't do that, doesn't raise the sex hormone binding globulin. If you take it orally, it does. So very commonly we use 3 or 4 types of transdermal approach. One is called a patch, which is very common. The other is called estrogel, all kinds of different product names, but the bottom line is an estradiol or an estrone, which is the second female hormone, and something called estriol, which is one of the 3 estrogens that are made naturally in nature. And you can rub them into your skin and they will get directly into your bloodstream like your ovaries used to do and release hormones into your system. And they are most commonly used now, and the rule of thumb of most doctors is to give you the least amount of estrogen that we can give you that solves your symptoms. So for the most part, that's our best approach to keeping people healthy going through the menopause and further beyond. Now, of course, the obvious question is, what's the risk of estrogens? And the risk of estrogens are an increased chance of deep vein thrombosis, as Dr. Ben Simon stated. The estrogen replacement can cause that. It's not a dramatic change. It changes from 1 in 10,000 to 4 in 10,000 for the risk of any kind of stroke related to estrogen replacement. And the other risk is one of side effects of estrogen alone, which can make you bloated, gain a little fluid weight. And of course, then the obvious one is breast cancer. And the breast cancer risk does go up after 5 years of use, but for the most part, it's still a moving line, and we're not quite sure because the original literature done from the Women's Health Initiative study, the WHI study, which was the watershed moment in time where everyone decided to judge hormones, is a very flawed study, and we're not quite sure as we move further whether there's really going to be much breast cancer risk as once stated. And the breast cancer risk in that study was stopped, that study was stopped because of the risk of breast cancer going up mostly because of estrogen and progesterone replacement, not only estrogen alone. So I hope that answers your question. It was a rather long one, but I hope it was informative.
That was a good question. We're giving out prizes. Pick a prize, seriously.
The purple box on the bottom.
Oh, that's not
All
this
right.
one.
All right.
I like purple.
Come on over here.
Thank you.
Okay,
Is that for a good question?
Thank
that's
you.
for a good, I just said, yeah, it's for a good question.
Sure.
I'm kidding.
I got a question.
Okay, no more questions.
That's the
Was
idea.
set to do it at my discretion, anyway. Another question, yes.
I don't want to guess what's in there.
Excuse me, it's Dr. Emmer? If I said
Dr.
that
Emmer.
correctly?
Yeah.
You had mentioned about the ear, nose, and throat, talking about the thyroid.
Yes.
When you don't have someone that has a thyroid and they come and see you, does that affect any part of you compared to like an endocrinologist? What is it that you do differently?
I surgically remove the thyroid. The
Okay.
endocrinologist medically treats the thyroid.
Okay,
And
that's the difference.
That's the difference.
And then my second question to you, which is,
One question, I just
oh,
want to make
I'm
sure
sorry, it's
everybody.
just a really quick question.
It was
out
short,
there.
it was short.
Okay, okay.
I'm sorry.
Don't make it just a habit, yes.
It's a hearing question which everybody will appreciate.
Okay.
I just want to know, what age is like statistically the normal age for us to lose our hearing?
What did you say?
Yes, that one.
Well, statistically, a lot of
And
that
based on the
How
depends.
many kids
consultation
have?
reports
It
too.
depends on excessive noise exposure.
Okay,
Okay, so it's really the workplace, rock and roll music, and even a hereditary component too.
Okay.
You put all that together, but the number one cause of early onset hearing loss is excessive noise exposure, and that's in addition to ringing in the ears too.
and that ringing in the ears, is that supposed to go away?
Supposed to. We want it to go away, but ringing in the ears, you know, everyone is affected what they call subjective tinnitus throughout your life. And most of the time it's intermittent. But there's a vast array of, there's probably 100 different causes. Unfortunately, there's 100 different treatments. But the number one cause of ringing in the ears is excessive noise exposure, a history of it. And if we can try to tamper that down, I think that, that you should be able to avoid that.
Thank you.
Sure.
Okay. Yes, Rabbi Link.
I have 3 questions. I guess you could just answer only whichever one you want. But this is questions I'm sure everybody's going to want to answer.
Okay,
only
one.
They can answer whichever one they want. He's smart. He's the only one.
Is this for the whole panel?
This is for the whole panel.
Oh, okay. One, two.
What's your take on vitamins? On organic? What's vitamins, organic? And then the third one is, what's the doctor's feeling on healthcare reform?
First question.
You can count it as 2, I guess. You can-
Trish, okay, who would like to start?
This is not my favorite question, the vitamin question, because it's not something really my specialty, so I'm gonna pass.
Come on.
I believe that if you have a well-rounded diet, especially in today's day and age, and you cut down on processed foods, I think the majority, multivitamins I don't think are absolutely necessary. And I don't advocate either my patients or myself or my family unless you have a underlying deficiency.
Well, we all know that vitamins are important for developing fetuses, so from my perspective obstetrically, everyone goes on vitamin therapy, specifically folic acid is very important for brain development. And in English and Irish populations, it's even more necessary for neural tube defects. I will say that I echo my colleagues and tell you that a good, solid, well-balanced American diet will give you, for the most part, what you need. I personally had a problem where I was not out in the sun and I was wearing great sunblock, and I actually turned up with a decreased vitamin D deficiency. So on that basis, I needed to be treated for it. So, you know, I think the answer to your question for me is periodically you should get tested for your hormone, for your vitamin levels, because you'll be surprised that you may be missing something vital. But I don't think just randomly taking vitamin replacement for no obvious reason is a really good notion. Also, please note that vitamins are somewhat dangerous. Vitamin D, E, A, and K are all fat soluble, and they can be toxic. So you need to be careful not just to take willy-nilly some kind of a vitamin replacement program.
Vitamins are like the Talmud, where you have sages stating different statements, and everybody's right and nobody's wrong, and all of the studies are controversial and have shown the good effects and the bad effects. Calcium could be good for the bones, but yet it promotes nephrolithiasis, kidney stones. Vitamin D is important, yes, now it's popular. Everybody's on vitamin D, me included. But maybe later on some study will come up showing some deleterious effect. CoQ10, it was promoted, touted as being very good for the heart. Not so. There is no randomized study that came up with a definite evidence of any benefit from CoQ10, nor vitamin E, nor any other vitamins, vitamin C, nor none of them. Baby aspirin was even controversial. Well, I still take it on a daily basis, but it has also some problem that you have to tolerate it. Yeah, you know, if you don't have a gut problem, and, so everything comes at a price. So overall, if you have a very balanced diet, like Dr. Emmerich said, I think there is no real need for vitamins. Maybe for the lady to take some cultured D and folic acid, particularly during pregnancy, and those vitamins are essential, you know. But otherwise, if you have no deficiency in your body in terms of iron deficiency or B12 deficiency, folic acid deficiency, I think if you have a well-balanced diet, you could take a multivitamin. It doesn't hurt, but not getting into the mega vitaminosis where you do develop some liver problems and even promote the formation of some cancers, God forbid.
Thank you. Now, I'm not showing any favoritism, but since Dr. Shooter passed, oh, do you want to say something about it?
Actually, I have a question for Dr. Ben Simon. Where the rest of the three of us faces all the time, patients taking vitamin E and fish oil, garlic pills, you know, they're blood thinners, they're actually quite strong blood thinners. And I'm curious what your thoughts are.
Fish oil has been proved to be of great benefit lately, and yes, fish oil. I do believe I take a fish oil pill every day along with the baby aspirin and some vitamin D. But again, everything has to be in moderation and not getting. I see patients that are busy all day long swallowing pills, 20, 30 of them, and buying them at a very high price. I think personally, it's a waste of money and it's even dangerous. Of course, there's some doctors are selling them in their offices. They want to make a big market out of it. But honestly and truthfully, except in certain instances where it's indicated, I think a well-balanced diet would do the most. Antioxidants for the longest time were promoted as being of great help to the heart. Not so. So we have to think twice. You know, everything can be analyzed, but also criticized, and becomes controversial.
Let me just add one quick thing. I want to give you a disclaimer. All of you gentlemen up here and I probably were trained in an age where vitamins were really not taught in medical school. And if this was a conversation that was taking place in California by a much younger group of people, you may have given a much different opinion. So let me just place that disclaimer that I can speak for myself. When I was training, vitamins were ignored. And so I can't tell you I speak with a tremendous amount of background in nutraceuticals or treatment with vitamins.
Thank you.
What am I chocolate liver over here?
A lot of vitamins in chocolate.
Vitamin K, a lot of iron.
So if you figured it out, Dr. Shooter, it's not his field. Dr. Emmerich says, clear cut, you don't have to worry with a well-balanced American diet. Dr. Cutson says folic acid, and there was a couple other ones over there. And then there's other ones that'll kill you, all the bees or whatever else it was. Dr. Ben Simon says, like Dr. Emmer, but when it started getting a little bit more, it was vitamin D, and it was a baby aspirin, and it was fish oil, right? So, you got it? So what are we going to do from all those answers? Learn Torah. I'll tell you why. Okay, I'll tell you why. That's my answer to your question. Actually, how do we know that a person should even turn to a doctor? According to Jewish tradition, a Jew is always directed by the Torah. That's how he should be, at least. As a Jew, this is our code of behavior. And so we always must refer to the Torah. What does it tell us? What does God tell us? That's our contract with God, right? So when you think about it, if God made somebody poor, or God made somebody not well, I mean, who has the right to go and change it? That was God's intention. But the Torah says that when you're not well, you really should go to the doctor. Not because the doctor has the answer and because he's going to cure you. Because when you think about it, Jackie Mason has some really good liners, one-liners and two-liners. You know what? Your parents were trying to kill you. When they gave you eggs every day, they were packing you in with cholesterol and a bunch of other things. I mean, the doctors were killing you a few years ago until they discovered that they had to change their regimen, right? So when you go to a doctor and you think he has the answer, like the doctor said here, it was different 20 years ago, and it's going to be different in another 20 years. So when people would go to the Rebbe and they would ask him what to do when they had a medical issue, the Rebbe would say, go to the doctor and see what the majority of them tell you, what the consensus is, because you'll always get a million opinions. That's just the way people are. Everybody has a different way of looking at things, right? But in the end, put your faith in God. Because whatever it is that they give you, it's just because God wants us to put a finger. He wants us to put an effort. But in the end, whether we'll be successful in our effort, and this applies to everything in life, it depends on God. Will our bodies absorb? Will it work the way it was intended? Is it really right for the moment? And a million different others, a million and one other things that never make anything sure. And that's my answer to your question. How was that? Okay.
How late are we going? Okay, anybody
You could
have?
ask the doctors how much longer they want
Yes.
to sit around.
Do we have a?
People, help yourself after medical.
Okay, the gentleman in the back? Yes.
Just a general question for the cardiologist, Dr. Ben Simon, but for anybody. I guess in the advancement of medicine and the fact that we have so many new technologies kind of giving us the answers for us, how do you see that in retrospect? Say, for example, back 20, 30 years ago, before you had CT scans, before you could do catheterizations, you had to sit with the patient for a good, more than 2 minutes than what you said earlier. You had to sit with them 10, 20, 30 minutes and get every information you can. Spend the time doing diagnostic tests with your hands, with the knowledge you had directly. How do you see that compared to today, where you literally walk in for 2 minutes, talk to them, put your the stethoscope on their chest, but really the EKG and the echo and the CT, I've already told you everything. And I'm not saying it's a bad thing. I'd just like to hear your opinion.
We go back to the basics. You're right. Like Dr. Kotzen said, there is nothing like a good physical history and a physical and spending the time, developing some good clinical skills and listening to the patient. And a good history is extremely important. So before we go on our high horses and ordering all these sophisticated tests, which, by the way, are very prohibitive, and the government is making sure that we do not order too many of them, because we cannot afford them. When we know that a PET scan is like several $1,000s, not to mention the amount of radiation, which is very, very dangerous. Of course, we get the information that we need, but it comes at a very high cost and cannot be applied to the whole population in the United States. The same way we do mammograms on every lady, not to say, God forbid, that it's not warranted, but you know how many billions of dollars have been sent every year? And Dr. Rosenberg could tell you how much radiation these ladies are exposed, and this repeated radiation could lead to cancer. So there is always a flip side to everything. So that's why we always need a doctor.